Hi, my name is Taylor and I'll be the OT helping you go through these stump care procedures and wrapping today for your lower extremity amputation. So we know there are two types of amputations. There is above the knee and below the knee, and we'll be focusing on the below the knee amputations. Prior to beginning your care and wrapping, you will want to perform a skin integrity check. This is basically just to make sure that there aren't any new blisters, pressure sores, soft spots, and things like that that can be prone to infection or cause pain while you're wearing your dressing or prosthesis if you have one. And you can do this by just checking yourself by using your hands and feeling around your stump area, or you can even use a mirror to check below your leg to see the spots that you might miss. So there are a few precautions to be mindful of. You'll want to make sure that your hands are clean and washed before and after the dressing to prevent infections. You'll want to make sure that you keep the dressing dry, and if it is soiled, you'll want to notify someone and make sure that you're able to clean it or get a new one. You'll want to keep a healthy diet so we can promote tissue healing. And lastly, notify pain if any does occur. That way, whenever you are dressing or using a prosthesis, you aren't causing any more pain or any more discomfort while you're doing some daily occupations like functional mobility, transfers, or beginning to stand while you're making a meal with your new prosthesis or using the dressing. So overall, it's just really important to make sure that you know how to clean, care, and maintain your dressing and prosthesis. So when beginning to wrap a below the knee amputation, you'll need an ACE bandage, and we will be mindful as we move through 3 different movements. We'll start with a U shape, then cross over into a T, and we'll begin forming figure 8s, but I can show you that. We'll want to make sure that our patient is resting their leg on a chair or the edge of the bed. That way we have enough room to begin wrapping, but their leg isn't hanging and causing any strain on the joints or pain. So we'll begin with our ACE bandage. We can start by putting the tip of our bandage on the very end of the stump. We'll wrap it around the back like a U shape, and then we'll grab with our other hand to cross over into a T. So you have a U and then a T. Next, you'll bring it down the back and kind of cross over diagonally upwards to make an 8. And we'll do the same at the top. We'll cross over and then go down. Cross at the bottom and bring back up. Cross at the top and bring back down. And you'll want to see kind of some diagonal shapes as you're doing that. That'll be your indicator of being able to tell that you're creating these figure 8s, right? And we'll want to start with more firm pressure at the bottom and kind of decrease the pressure as we're moving up the leg. That way we can get the blood flowing. And once you have it all wrapped, you can grab your pins to make sure that the bandage doesn't move. And I can show you, you will want kind of a shape like this with the diagonals. That way you know that you're doing your figure 8s right, and it's a little bit tighter at the bottom but gets a little more loose as we move up the leg for that blood flow. So for the below the knee amputation, like I said, you'll start at the top of the stump area. You'll make a U, and then you'll cross it over around the back to make a T shape. You'll bring it down into a diagonal to begin making an 8. And you'll start with pressure at the bottom. Wrap it around the front, bring it down diagonally, wrap it around the bottom, bring it back up, Wrap it around the top to keep making the figure 8s. Bottom, up, top, diagonal. And you'll start with pressure at the bottom, but then you will ease up at the top to allow for blood flow. And continue the figure 8s until you're out of the ace bandage, and then you can pin your wraps, but you should have some triangle and diagonal shape there to know that you did your 8s right.